What's up, everyone? Janet here. Today, we're tackling a topic that is incredibly serious and time-sensitive. Every 40 seconds, someone in the United States has a heart attack. Think about that for a moment. By the time you finish watching this short intro, several people will have experienced this life-threatening event. This isn't just a statistic, it's a reality for millions of families. The most tragic part? So many of these events could have a better outcome if people simply knew what to look for and, more importantly, how to react. We're going to break down the confusion and give you clear, actionable steps. The classic image of a heart attack, the one we see in movies, someone clutching their chest and collapsing, is only part of the story. In reality, the signs can be much more subtle, insidious, and easy to dismiss. And that's the danger. Nearly half of all heart attack victims ignore their symptoms for hours, sometimes even days, thinking it's just indigestion, anxiety, or muscle strain. They wait, hoping it'll go away. But with a heart attack, waiting is the one thing you can't afford to do. Every single minute that passes, more heart muscle is dying. That's irreversible damage we want to prevent. That's why I've collaborated with a team of leading cardiologists to bring you the most up-to-date, life-saving information. We're not just going to talk about symptoms, we're going to give you a 5-step emergency action plan. This isn't just medical theory, these are the critical steps that emergency room doctors and paramedics wish everyone knew. Knowing this information won't just protect you, it could empower you to save the life of a parent, a partner, a co-worker, or even a complete stranger. These symptoms aren't always dramatic, but missing them can be absolutely deadly. So I want you to stay with me for this entire video, don't click away. What you're about to learn is more important than any viral trend or cat video. This is about life and death. We're going to arm you with knowledge that cuts through the noise and gives you the confidence to act decisively when it matters most. We'll cover everything from the silent symptoms most people miss to the exact words you need to say in the ER to ensure you're taken seriously. This is your guide to taking control in a moment of crisis. Let's dive in. All right, let's get right into the most crucial piece of the puzzle, recognizing the signs. When I say heart attack, what's the first thing that comes to your mind? For most people, it's that classic crushing chest pain, often described as an elephant sitting on your chest. And yes, that is a primary symptom, what we call angina. It can feel like pressure, squeezing, fullness, or a sharp pain right in the center or left side of your chest. It might last for more than a few minutes, or it might go away and come back. This is the signal we've all been taught to look for, and you should never, ever ignore it. But here's where it gets complicated and dangerous. A heart attack doesn't always read the textbook. The pain isn't always confined to the chest. It can radiate, which means it travels to other parts of your upper body. You might feel discomfort or pain in one or both arms, often the left arm, but not always. It can also manifest as pain in your back, between your shoulder blades, or you might feel it in your neck, your jaw, or even your stomach. This is because the nerves connected to the heart are complex, and your brain can misinterpret where the pain signals are actually coming from. Think about how easy it would be to dismiss these symptoms. Jaw pain, maybe you think you slept on it wrong or have a dental issue. Back pain, you might blame it on that heavy box you lifted yesterday. Stomach pain? You'll probably reach for an antacid, assuming it's just heartburn or indigestion. This is precisely why so many people delay seeking help. They rationalize the symptoms away, attributing them to something benign and familiar. But these atypical presentations are incredibly common and just as deadly as the classic chest pain we all expect to see. So the first major takeaway is to broaden your definition of what a heart attack feels like. It's not just about the chest. It's about a constellation of symptoms in the upper body. Other key signs to watch for include breaking out in a cold sweat for no apparent reason, sudden nausea or vomiting that isn't related to something you ate, and feeling unusually lightheaded or dizzy, as if you're about to faint. If you experience any of these, especially in combination, your internal alarm bells should be ringing loud and clear. Now, we need to have a serious talk about how these symptoms present differently in women, because this is a life or death distinction that is too often overlooked. While women can and do experience chest pain during a heart attack, they are significantly more likely than men to experience the other, more subtle symptoms we just discussed. Things like shortness of breath, nausea and vomiting, and back or jaw pain are often the primary and sometimes the only signs a woman will have. This is a critical point that the medical community is still working to fully understand and educate the public about. This difference in symptoms leads to a terrifying and unacceptable disparity in care. A landmark study revealed a shocking statistic. Women are 50% more likely than men to be misdiagnosed during a heart attack. Let that sink in. 50%. That means a woman can walk into an emergency room, describe her symptoms accurately, and still be sent home with a diagnosis of anxiety, indigestion, or musculoskeletal pain, only to suffer devastating consequences later. This isn't just a statistic, it's a systemic failure with real human cost. Why does this happen? It's a combination of factors. For decades, most cardiac research was conducted primarily on men, creating a male-centric model of what a heart attack should look like. This historical bias is baked into medical textbooks and training. Furthermore, women themselves may be more likely to downplay their symptoms, conditioned to prioritize the needs of others over their own health, or to not want to seem dramatic. They might feel extreme, unexplained fatigue for days leading up to the event and just brush it off as being overworked or stressed. This is why awareness is so powerful. We have to unlearn the old stereotypes. For women, the most common symptoms can be shortness of breath, weakness, and unusual fatigue, sometimes for days before the actual event. They might also experience sleep disturbances, anxiety, and that feeling of indigestion more prominently. If you are a woman, or if you have important women in your life, your mother, wife, sister, or daughter, you need to burn these symptoms into your memory. Recognizing them for what they are is the first step in overcoming that diagnostic gap. Comment heart below if you've ever experienced these symptoms and weren't sure what they were. Beyond the specific symptoms, there's another powerful indicator that something is seriously wrong: a profound sense of impending doom. Now, this isn't just feeling anxious, it's a distinct, overwhelming feeling that something terrible is about to happen. Patients who have survived heart attacks often describe this sensation with remarkable clarity. They say it was a feeling unlike any other they had ever experienced. It's your body's most primal alarm system screaming at you that you are in grave danger. This is not a symptom to be psychoanalyzed. It's a symptom to be acted upon immediately. This feeling, medically known as anger anomie or anguish of the soul, often accompanies the physical symptoms. So imagine feeling that unexplained jaw pain, the shortness of breath, and on top of it all, a wave of sheer terror washes over you for no logical reason. That combination is a massive red flag. Your autonomic nervous system is going into overdrive, reacting to the catastrophic event happening inside your chest. It's a physiological response to a life-threatening crisis, and honestly, it's one of the most reliable, albeit terrifying, clues you can have. So, how do you put it all together? You have to become a detective of your own body. Don't isolate symptoms. Look at the whole picture. Are you feeling a strange discomfort in your upper body that you've never felt before? Is it accompanied by sweating, shortness of breath, or nausea? Does it feel off in a way that you can't quite explain? Do you have that gut-wrenching feeling that something is deeply wrong? If the answer is yes to any of these combinations, you cannot afford to wait and see. You have to assume it's your heart until proven otherwise. The key is to trust your intuition. You know your body better than anyone. You know what normal fatigue feels like, and you know what normal indigestion feels like. A heart attack will feel different. It will feel new, unexplained, and alarming. Don't let self-doubt or the fear of being wrong stop you from making a phone call that could save your life. It's always, always better to be safe than sorry. Being checked out for what turns out to be a false alarm is a minor inconvenience. Ignoring a real heart attack is a fatal mistake. Okay, you've recognized the signs. You suspect it might be a heart attack. What is the very first, most critical action you must take? It's simple and it's non-negotiable. You call 911, not your doctor's office, not your spouse, not your neighbor. You pick up the phone and you dial 911 immediately. I spoke with Dr. Reed, a top interventional cardiologist, and his advice was crystal clear: call at the first sign of suspicion. Don't wait for the symptoms to get worse. Don't wait to see if they'll go away on their own. The moment the thought this could be a heart attack crosses your mind, that is your cue to act. There's a saying in cardiology: time is muscle. It's one of the most important phrases in all of medicine. What it means is that during a heart attack, a part of your heart is being starved of oxygen-rich blood because of a blockage in a coronary artery. For every minute that goes by, more of that heart muscle tissue begins to die. And once that muscle is dead, it's gone forever. It turns into scar tissue, which doesn't contract and can't help your heart pump effectively. This can lead to long-term heart failure, disability, and a drastically reduced quality of life. The number one predictor of survival and recovery from a heart attack isn't how old you are or how healthy you were before the event. It's how fast you get definitive medical treatment. The goal is to get that blocked artery opened up as quickly as possible to restore blood flow. This is a race against the clock where every second counts. Calling 911 is like firing the starting pistol in that race. It sets in motion a chain of events designed to get you life-saving care in the shortest amount of time possible. Hesitating for even 10 or 15 minutes can mean the difference between a full recovery and permanent heart damage. So let's be perfectly clear about this. There is no symptom too small, no suspicion too vague to warrant a 911 call. Emergency responders would much rather arrive and find out it was a false alarm than be called too late to make a difference. Don't feel embarrassed or worried that you're being a burden. You are not. You are being smart, you are being proactive, and you are taking your health seriously. This is your life we're talking about. The single most important decision you will make in that moment of crisis is to pick up the phone and ask for help. Some of you might be thinking, why call an ambulance? The hospital is only 10 minutes away. I can have my partner or a friend drive me much faster. This is one of the most common and dangerous mistakes people make. Calling 911 isn't just about getting a ride to the hospital. It's about bringing the hospital to you. Paramedics are highly trained medical professionals, and their ambulance is a mobile emergency room. The moment they arrive, your treatment begins. This is a massive advantage that you completely forfeit by driving in a private car. The first thing paramedics can do is perform an electrocardiogram, or an ECG, right there in your living room. This test measures the electrical activity of your heart and is the fastest way to confirm if you're having a specific, very serious type of heart attack called an ST elevation myocardial infarction, or a STEMI. The paramedics can then transmit this ECG data directly to the emergency room of the nearest appropriate hospital while you're en route. This allows the hospital to activate the cardiac catheterization lab team before you even arrive, saving precious, muscle-preserving minutes. Furthermore, paramedics can start life-saving interventions immediately. They can administer oxygen to help reduce the strain on your heart. They can give you aspirin to start thinning your blood and breaking up the clot. They can start an IV line so that emergency medications can be given quickly once you reach the hospital. And most importantly, if your heart were to suddenly stop, if you were to go into cardiac arrest, they are equipped with a defibrillator and the skills to perform CPR. Your chances of surviving a cardiac arrest outside of a hospital plummet without this immediate intervention. Let's also address a common fear: the cost. Many people hesitate to call 911 because they're worried about the bill, especially if they don't have insurance. Please do not let this be a factor in your decision. Under federal law, EMTALA, any hospital emergency room that accepts Medicare must provide a medical screening and stabilizing treatment for an emergency condition, regardless of your ability to pay. Your life is worth more than any medical bill. The financial details can be sorted out later. In the moment of crisis, your only job is to get help. When you make that 911 call, being clear and concise is absolutely vital. The dispatcher will ask you a series of questions, so try to stay as calm as you can and answer them directly. The very first thing you should say is, "I think I am having a heart attack." Use those specific words. This immediately elevates the priority of your call. Don't say, "I have chest pain" or "I don't feel well." Be direct. This clarity really helps the dispatcher send the right resources with the appropriate level of urgency. They need to know this is a potential cardiac event. Next, give them your exact location. If you're at home, provide your full address, including any apartment or unit number. If you're in a public place, be as specific as possible. Give them the name of the building, the floor you're on, or nearby cross streets and landmarks. If you can, send someone outside to flag down the ambulance. While you're on the phone, the dispatcher may give you instructions, such as unlocking your front door or lying down. Follow their instructions carefully. They are trained to keep you safe until help arrives. If you are with someone who is experiencing symptoms, you are their lifeline. Make the call for them. Tell the dispatcher what symptoms the person is experiencing and when they started. Let them know the person's age, and if they have any known heart conditions, do not leave the person alone unless you absolutely have to, for example, to unlock the door for the paramedics. Your calm presence and clear communication with the 911 operator can make a world of difference in the efficiency and speed of the emergency response. Remember, the clock started ticking the moment the symptoms began. Every action from that point forward should be focused on one goal: minimizing the time to treatment. By calling 911, you're making the single best choice to achieve that goal. You are activating a system designed for this exact scenario. You are putting yourself or your loved one in the hands of professionals who have the tools, the training, and the protocol to save a life. You are taking the guess out of the equation and replacing it with decisive, life-saving action. All right, so you've made the most important call of your life. 911 is on the way. But now, another critical decision point arises. You might be thinking, the hospital is just a few minutes away. I can get there faster if I just drive myself. I completely understand that impulse, that feeling of wanting to take control in a chaotic, terrifying situation. You feel the clock ticking, every second stretching into an eternity, and the urge to just do something is overwhelming. But I'm here to tell you as a doctor that getting behind the wheel of a car during a potential heart attack is one of the most dangerous decisions you can possibly make. It's a gamble not just with your own life, but with the lives of everyone else on the road. Let's break down exactly why this is such a bad idea. When your heart is under extreme stress, deprived of oxygen, its rhythm can become dangerously unstable. This can lead to a sudden loss of consciousness with absolutely no warning. 1 second you're driving, focused on the road, and the next, you've blacked out. The consequences are catastrophic. Your foot could slump onto the accelerator, or you could lose control of the steering wheel entirely, veering into oncoming traffic or off the road. This isn't just a theoretical risk. It's a very real and terrifying possibility that turns a personal medical emergency into a potential multi-car pileup, endangering innocent people. Think about the physiology of what's happening. A heart attack means a part of your heart muscle is dying. This can cause extreme pain, dizziness, shortness of breath, and disorientation, all symptoms that severely impair your ability to operate a vehicle safely. Your reaction time is slowed, your judgment is clouded by pain and panic, and your vision might even blur. Driving requires constant focus and split-second decisions. Attempting to do so while your body's most vital organ is in crisis is like trying to fly a plane during a hurricane while the engine is on fire. It's a recipe for disaster that dramatically lowers your own chances of survival. Dr. Adam Beachy, a cardiologist I respect, puts it bluntly. Driving yourself is a lose-lose situation. If you make it to the hospital, you've wasted precious time that paramedics could have been using to treat you. If you don't make it, the outcome is unthinkable. So I need you to make me a promise. If you ever find yourself in this situation, resist that urge to grab your keys. Your car is a mode of transportation. It is not a substitute for an ambulance. The single best thing you can do after calling 911 is to stay put, stay calm, and wait for the professionals to arrive. So, what makes waiting for that ambulance so much better than driving? It's simple. The paramedics aren't just a taxi service to the hospital. Think of an ambulance as a mobile emergency room that comes directly to you. The moment those professionals walk through your door, your treatment begins. This is a critical distinction. Every single minute that a coronary artery is blocked, more heart muscle is permanently damaged. Paramedics can immediately start interventions that can literally save that muscle and, by extension, save your life. They bridge the gap between your home and the hospital with active life-sustaining care, something you simply cannot get in the back of a car. Let's get specific about what these highly trained lifesavers can do. First, they can administer oxygen. During a heart attack, your heart is starved for it, and providing supplemental oxygen can help reduce the strain and limit the damage to the heart muscle. Second, and we'll talk more about this in the next step, they can give you aspirin. They know the correct dosage and can ensure you take it safely, which is a crucial first step in breaking up the clot causing the heart attack. They are trained to handle this, taking the guesswork out of a high-stress situation for you and your family. This immediate medical intervention is something you absolutely cannot replicate on your own. Furthermore, paramedics have advanced equipment right there in the ambulance. They can start an IV line, allowing them to administer medications directly into your bloodstream for the fastest possible effect if your condition worsens. Most importantly, they can perform an electrocardiogram, or ECG, right on the spot. This test reads the electrical activity of your heart and can confirm if you are having a heart attack. They can then transmit this information directly to the emergency room doctor who will be waiting for you. This gives the hospital a critical head start, allowing them to assemble their cardiac team and prepare the catheterization lab before you even arrive. This pre-hospital notification is a game changer. It shaves precious minutes, even tens of minutes, off your door-to-balloon time. That's the time from when you arrive at the hospital to when doctors inflate a balloon in your artery to restore blood flow. The national goal is under 90 minutes, and every minute saved translates directly to more heart muscle saved and a better long-term outcome. By calling an ambulance, you're not just getting a ride. You're activating a sophisticated, life-saving system designed to give you the absolute best chance of a full recovery. Driving yourself completely bypasses this entire critical system. The role of paramedics extends beyond just medical treatment. They provide a crucial element of safety and support. If your heart were to go into cardiac arrest, meaning it stops beating altogether, your chances of survival drop by about 10% for every minute that passes without CPR and defibrillation. In your car, alone, your chances are effectively zero. In an ambulance, you are surrounded by trained professionals with a defibrillator, the very device designed to shock your heart back into a normal rhythm. They are your safety net, equipped and ready to handle the absolute worst-case scenario, a scenario no one should ever face alone on the side of the road. This brings me to a crucial point about community preparedness. While paramedics are the ultimate professionals, sometimes the first person on the scene is a bystander, a family member, or a co-worker. Knowing what to do in those first few moments before help arrives can be the difference between life and death. This is why I am a huge advocate for CPR training. It is an empowering skill that can turn a feeling of helplessness into one of decisive, life-saving action. You don't need to be a medical professional to learn it, and you never know when you might be called upon to use it to save a loved one or even a stranger. Getting trained is easier than you might think. The American Heart Association, or AHA, offers courses all over the country. All you have to do is go to your favorite search engine and type in AHA CPR followed by your zip code. You'll find a list of classes near you, many of which can be completed in just a few hours. This is an investment not just in your own knowledge, but in the health and safety of your entire community. Imagine the peace of mind knowing that you have the skills to act confidently and correctly in a cardiac emergency. It's an incredibly powerful tool to have in your back pocket. So, let's recap this crucial step. Never, ever drive yourself to the hospital if you suspect a heart attack. Call 911 and let the mobile emergency room come to you. They start treatment immediately. They have life-saving equipment, and they communicate with the hospital to prepare for your arrival, saving critical time. And while you're thinking about preparedness, take that extra step and look up a local CPR class. Empowering yourself with knowledge is one of the best things you can do for your health and the health of those you care about. It's about being ready to make the right choice when it matters most. Okay, you've called 911 and you're waiting for the professionals to arrive. Now we move to step 3, a simple action that can have a profound impact on the outcome of a heart attack: chewing aspirin. Now, I want to be very clear about this. This isn't just about taking an aspirin. The method is just as important as the medication itself. You must chew it. I know that might sound strange. Aspirin doesn't exactly taste great, and your first instinct might be to just swallow it with a glass of water. But in this specific high-stakes situation, chewing is non-negotiable, and there's a very clear scientific reason why this is so critical for your survival. Let's dive into the pharmacology here. When you swallow a pill, it has to travel down your esophagus, into your stomach, and then into your small intestine before it can be absorbed into your bloodstream. This entire process takes time you simply do not have when your heart muscle is being starved of oxygen. Chewing the aspirin, however, completely changes the game. It creates a large surface area of tiny aspirin particles in your mouth. These particles can then be absorbed directly into your bloodstream through the rich network of blood vessels under your tongue and in your cheeks, a route we call sublingual and buccal absorption. This shortcut makes a massive difference. Studies have shown that chewing aspirin allows it to reach peak concentration in your bloodstream up to 3 times faster than swallowing it whole. We're talking about getting the medicine to where it needs to go in as little as 5 minutes, compared to 15 or 20 minutes with swallowing. In the context of a heart attack, where time is muscle, those saved minutes are absolutely priceless. Each minute that blood flow is blocked, more heart cells die. By chewing, you are kick-starting the therapeutic process almost immediately, giving yourself the best possible head start on fighting the clot. So when the 911 operator or a medical professional tells you to take aspirin, remember this key detail. Don't just pop it in your mouth and swallow. Break it up with your teeth. Chew it thoroughly, even though it's chalky and bitter. Let the particles dissolve in your mouth as much as possible before swallowing. This simple change in technique dramatically accelerates the drug's absorption and its life-saving effects. It's a perfect example of how a small piece of medical knowledge can empower you to take a hugely beneficial action during a moment of crisis, maximizing your chances of a positive outcome. Now that we've established the importance of chewing, let's talk about the why and the how much. Why aspirin? What is it actually doing inside your body? A heart attack is most often caused by a blood clot that has formed in one of the coronary arteries, blocking the flow of oxygen-rich blood to a section of the heart. Aspirin is an antiplatelet medication. Platelets are tiny blood cells that rush to the site of an injury to form a clot and stop bleeding. In the case of a heart attack, this helpful process goes haywire, forming a clot that obstructs a vital artery. Aspirin works by making these platelets less sticky, preventing them from clumping together and making the clot bigger. This action is crucial. By inhibiting platelet aggregation, aspirin helps to slow down the growth of the clot and can even help your body's natural clot-busting systems to start breaking it down. It's the first line of defense in re-establishing blood flow to the suffering heart muscle. It doesn't eliminate the clot entirely. That often requires more powerful medications or procedures at the hospital, but it buys you incredibly valuable time. It helps to stabilize the situation and prevent it from getting worse while you wait for the ambulance to arrive and transport you to definitive care. Think of it as putting the brakes on a runaway train. So what is the correct dose? This is important. The recommended dose during a suspected heart attack is 325 milligrams. Now, you might not have a bottle that says 325 milligrams on it, and that's okay. You can achieve this dose in a couple of ways. One standard full-strength adult aspirin is typically 325 milligrams. If you have that, you just need to chew 1 tablet. However, many people only have low-dose or baby aspirin at home, which is often recommended for daily prevention. These tablets are usually 81 milligrams each. In that case, you would need to chew 4 of the 81 milligram baby aspirins to get to the target dose of 324 milligrams, which is perfectly acceptable. It's a good idea to know what you have in your medicine cabinet right now. Go check. Do you have full strength or baby aspirin? Knowing this ahead of time can prevent confusion and delay during an actual emergency. Make sure it's not enteric coated or safety coated, as that coating is specifically designed to slow down absorption, which is the exact opposite of what you want. You want immediate release aspirin. 1 adult tablet or 4 baby tablets, chewed, not swallowed. This precise dosing ensures you get the full, rapid antiplatelet effect needed to fight the clot effectively. Now, as with any medication, we have to talk about the important exceptions. While chewing aspirin is a life-saving step for most people having a heart attack, there are specific situations where it could be harmful or even dangerous. This is not a one-size-fits-all recommendation, and it's crucial to know if you fall into one of the categories where you should not take aspirin. The first and most obvious contraindication is if you have a known allergy to aspirin or other nonsteroidal anti-inflammatory drugs, or NSAIDs. If you've had a reaction like hives, swelling, or difficulty breathing after taking aspirin in the past, do not take it now. The risk of a severe allergic reaction on top of a heart attack is a dangerous combination. The second major warning is for people who are already taking prescription blood-thinning medications. This includes drugs like warfarin, also known as Coumadin, apixaban, which is Eliquis, rivaroxaban, or Xarelto, or clopidogrel, also called Plavix. These medications are already doing the job of preventing blood clots. Adding aspirin on top of these powerful anticoagulants can increase the risk of a major bleeding event, such as a hemorrhagic stroke or internal bleeding, which can be just as life-threatening as the heart attack itself. If you are on one of these medications, do not take aspirin unless you are explicitly told to do so by a 911 operator or a medical professional who is aware of your medical history. Another important consideration is a history of recent bleeding, such as a bleeding stomach ulcer or recent major surgery. In these cases, the risk of causing or worsening a bleed by taking aspirin might outweigh the benefit. This is why communication is so important. When you call 911, be prepared to tell the operator your key medical history, including your allergies and the medications you take. They are trained to triage these situations and will give you the safest instruction for your specific circumstances. Their guidance should always be your primary source of direction in the moment. So let's put it all together for this step. For the vast majority of people, chewing 1 325 mg adult aspirin or 4 81 mg baby aspirins is a critical, life-saving intervention during a heart attack because it gets into the bloodstream rapidly to stop the clot from growing. However, this action is not for everyone. You must skip this step if you have a known aspirin allergy or if you are already on prescription blood thinners. When in doubt, always follow the specific instructions given to you by the 911 dispatcher or the paramedics when they arrive. Your safety is the #1 priority. All right, let's get serious for a moment because this next step, step 4, is one of the most crucial and frankly one of the most frustrating things we have to talk about in modern medicine. You've recognized the symptoms, you've called 911, you've chewed an aspirin, you've done everything right. But what happens when you get to the hospital and the person in the white coat doesn't believe you? This isn't just a hypothetical scenario, it's a documented, dangerous reality. Implicit bias in healthcare is real, and during a cardiac event it can be fatal. It's the unseen barrier that can stand between you and life-saving treatment, a hurdle you have to be prepared to overcome. We're not just talking about feelings here, we're talking about hard data. A shocking 2019 study published in the Proceedings of the National Academy of Sciences revealed a significant and disturbing trend. The study analyzed over 1 million ER visits and found that when women and minorities presented with chest pain, they were less likely to be admitted for observation, received fewer diagnostic tests like ECGs, and experienced longer wait times than their white male counterparts with the exact same symptoms. Think about that. The same symptoms, but a different outcome based on your gender or the color of your skin. This isn't just an injustice, it's a medical emergency. So what does this bias look like in the real world, in that high-stakes ER environment? It can be subtle. It might be a doctor attributing your shortness of breath to anxiety without running a single test. It might be them dismissing your jaw pain as a dental issue. or your nausea as just a stomach bug. They might use coded language, describing you as dramatic or anxious in your chart, which can influence how the next doctor or nurse treats you. This is where you have to switch from being a patient to being your own fierce advocate. Your life literally depends on your ability to be heard and taken seriously in these critical moments. This is a systemic problem, and it's being talked about more and more, which is a good thing. I've even seen TikTok clips from medical residents and doctors breaking down how these biases are formed during training and how they are actively working to unlearn them. But while the medical community works to fix its internal issues, that process is slow. You don't have time for that when your heart muscle is dying. You need the tools to fight for yourself right now in the moment. You need to be armed with the language that cuts through the bias and forces the medical team to act based on evidence, not assumptions. This brings us to your first line of defense, your first power phrase. If you feel like you're being dismissed, I want you to look the healthcare provider in the eye. Stay calm but firm and ask this exact question. What is your differential diagnosis? This is not an aggressive question, it's a clinical one. It's a term every single doctor, resident, and physician assistant understands intimately. A differential diagnosis is the list of all possible conditions that could be causing your symptoms, ranked from most likely to least likely. It's the foundation of how we, as doctors, are trained to think through a patient's problem. Asking this question does something incredibly powerful. It forces the provider to pause their automatic and potentially biased thinking. It shifts the conversation from their gut feeling about you to a structured, logical medical process. They can't just say anxiety anymore. They have to verbally articulate to you what other life-threatening conditions they have considered and, more importantly, what they have done to rule them out. Have they considered a pulmonary embolism, an aortic dissection, and the most important one in this context, an acute myocardial infarction, a heart attack? It forces them to justify their clinical reasoning out loud. Let's play this out. Imagine the doctor says, well, it's likely just a panic attack. You respond, I understand that's on your list, but what is your full differential diagnosis? What have you done to rule out a cardiac event? This simple question changes the entire dynamic of the interaction. It signals that you are an informed patient, that you understand the stakes, and that a simple dismissal will not be enough. You are respectfully demanding a higher standard of care. You are asking them to do their job thoroughly and to prove to you that they have considered the worst-case scenario. Remember, a heart attack, especially in women, can present with symptoms that overlap with anxiety. Shortness of breath, a racing heart, a sense of doom. It's an easy and lazy diagnostic shortcut to just label it as anxiety. By asking for the differential, you are essentially saying, show me your work. You are forcing them to walk you through their thought process and to confirm that they have objectively ruled out the most dangerous possibilities before settling on a less severe diagnosis. This isn't about being difficult, it's about being diligent with your own life. If asking for the differential diagnosis doesn't produce the action you need, it's time to escalate. Your second power phrase is a statement of intent. I want it documented in my chart that you are refusing to run an ECG or test my troponin levels, despite my concerns about a heart attack. This, honestly, is the medical equivalent of drawing a line in the sand. Documentation is everything in medicine. A patient's chart is a legal document, and what's written in it, or what's omitted, carries immense weight. No doctor wants to sign their name to a chart that explicitly states they denied a standard, life-saving test for a patient presenting with potential cardiac symptoms. This phrase is so effective because it introduces an element of accountability. It's no longer just your word against theirs in a fleeting conversation. You are creating a permanent record of your request and their response. This often prompts an immediate change in behavior. The risk of being wrong and having that decision documented in writing is often enough to make even the most dismissive provider reconsider their position and order the test. It protects you in the moment by pressuring them to provide the standard of care, and it protects you later should there be a negative outcome due to their negligence. Now, let's say you've used both phrases and you're still meeting resistance, or maybe you just have a gut feeling that something is wrong and you're not being heard. It's time for your third and final power phrase. I need a second opinion. This is your right as a patient in any medical setting, and it is non-negotiable. You can request to speak to another doctor, the charge nurse, or a patient advocate. In a hospital, there is always a chain of command, and you have the right to climb it. Don't worry about offending the first doctor. Your politeness is not more important than your life. Requesting a second opinion brings a fresh set of eyes to your case. Someone who is not anchored to the initial, potentially biased diagnosis. Sometimes that's all it takes. The second doctor might see something the first one missed, or simply hearing the story again will raise the appropriate red flags. Dr. Khadija Breathitt, a cardiologist and researcher on this very topic, champions these phrases because they empower patients to navigate a system that can sometimes fail them. Remember them. What's your differential diagnosis? I want this documented and I need a second opinion. They are your keys to unlocking the care you deserve. We've spent this entire video talking about the terrifying high-stakes moments of a heart attack. We've covered the symptoms, the emergency steps, and how to advocate for yourself. But now we're going to talk about the most powerful step of all. Step 5 is about making sure to the best of your ability that you never have to use the first 4 steps. Prevention is power. The best way to survive a heart attack is to never have one in the first place. This isn't about fear-mongering, it's about empowerment. You have more control over your heart health than you probably think. The statistics on this are incredibly motivating. We're not talking about small, incremental changes. We're talking about massive risk reduction. The American Heart Association has laid this out clearly. Engaging in just 120 to 150 minutes of moderate intensity aerobic exercise per week can cut your risk of heart disease by an astounding 35%. That's just 2.5 hours a week. You can break that down into 30 minutes, 5 days a week. That could be a brisk walk, a bike ride, swimming, or even vigorous yard work. The point is to get your heart rate up and keep it there. Think about what that 35% reduction really means. It's like giving yourself a suit of armor against the #1 killer in the world, and the benefits go far beyond that single number. Regular exercise helps manage your weight, lowers your blood pressure, improves your cholesterol levels, and helps your body manage blood sugar, all of which are major risk factors for heart disease. It's the closest thing we have to a magic pill, but it's not a pill at all. It's a commitment you make to yourself, a daily or weekly investment in a longer, healthier life. So how do you start? You don't need a fancy gym membership or expensive equipment. Start with a walk around your neighborhood after dinner. Take the stairs instead of the elevator. Find a form of movement that you genuinely enjoy, because that's the one you'll stick with. If you hate running, don't force yourself to run. Maybe you love to dance. Put on some music in your living room. The key is consistency. Making movement a non-negotiable part of your routine is the single most effective preventive step you can take, starting today. Okay, so exercise is the foundation. But let's build on that with 3 specific actionable hacks you can incorporate into your life right now to supercharge your heart health. Hack number 1, check your blood pressure weekly. High blood pressure, or hypertension, is called the silent killer for a reason. Often, it has no symptoms until it causes a catastrophic event like a heart attack or stroke. You can't feel high blood pressure, you can only measure it, and you don't need to go to the doctor's office every time. You can buy an automated cuff online or at any pharmacy. Knowing your numbers is the first step to controlling them. The goal for most adults is a blood pressure below 120/80 millimeters of mercury. By checking it weekly, you establish a baseline. You can see how your diet, exercise, stress levels, and sleep affect it in near real time. This data is invaluable. If you see it consistently creeping up, you can make lifestyle changes, or, crucially, bring that data to your doctor to discuss medication before it becomes a full-blown crisis. This simple 5-minute weekly habit puts you in the driver's seat of your own cardiovascular health. Hack number 2 is simple and honestly delicious. Eat the rainbow. I'm not talking about Skittles here. I'm talking about fruits and vegetables. The different colors in produce aren't just for show. They represent different vitamins, minerals, and powerful antioxidants called phytonutrients. Red foods like tomatoes and watermelon contain lycopene, which is great for heart health. Orange and yellow foods like carrots and lemons are packed with vitamin C and carotenoids. Green leafy vegetables like spinach and kale are full of nitrates that help relax blood vessels. Blue and purple foods like blueberries and eggplant have anthocyanins, which are potent antioxidants. The goal here isn't perfection, it's variety. Don't just eat broccoli and apples every day. Challenge yourself to get as many different natural colors on your plate as possible throughout the week. This approach ensures you're getting a wide spectrum of the micronutrients your heart and blood vessels need to stay healthy and flexible. It makes healthy eating a fun game rather than a restrictive chore. Think of it as painting a masterpiece of health on your plate every single day, and your heart will thank you for it with every beat. This brings us to our third and most advanced hack, and it's about going deeper than the standard tests. Hack number 3, know your LDL-P. Now, most of you have probably heard of LDL cholesterol, the so-called bad cholesterol. Your doctor probably checks your LDL-C, which stands for LDL cholesterol concentration, on your standard lipid panel. This number tells you the total amount of cholesterol carried by your LDL particles. But here's the crucial detail that the standard test misses. It doesn't tell you how many particles there are. Think of it like this. LDL-C measures the total number of passengers or cholesterol on the highway. But what really causes the traffic jam, or the plaque in your arteries, is the number of cars, the LDL particles. You could have a normal amount of passengers, or LDL-C, but if they are all crammed into a huge number of tiny cars, meaning high LDL-P, you have a major traffic jam and a high risk of plaque buildup. LDL-P, which stands for LDL particle number, directly counts the number of these artery-clogging particles. For some people, especially those with insulin resistance or a family history of heart disease, their LDL-C can look normal while their LDL-P is dangerously high. This isn't a standard test, so you will likely have to ask for it specifically. It's often called an NMR lipoprofile or a cardio IQ test. Yes, it might cost extra and your insurance may not cover it, but isn't this information worth it? Knowing your LDL-P gives you and your doctor the most accurate picture of your true cardiovascular risk. It can be the piece of the puzzle that explains why someone with perfect cholesterol on a standard test still has a heart attack. It's about moving from basic screening to personalized, advanced preventive medicine. So I urge you, the next time you see your doctor for a checkup, start a conversation about advanced lipid testing. Ask them about measuring your LDL particle number. Being proactive about understanding your specific, nuanced risk profile is the pinnacle of prevention. It's about using the best science available to protect your heart. And for a comprehensive guide to all of this, don't forget to download my free heart health checklist. The link is right there in the description below. It puts all this information right at your fingertips. We've covered a tremendous amount of critical life-saving information today. From the silent symptoms most people miss to the 5 emergency steps that can mean the difference between life and death. We've talked about the urgency of calling 911, the power of a single aspirin, and the crucial phrases you need to advocate for yourself in a biased system. We've also explored the incredible power of prevention, how simple changes in your daily life can fundamentally change your future and protect the only heart you will ever have. But information is only powerful if you use it and share it. Your heart doesn't get a second chance. It doesn't get a do-over. Every beat is precious, and it's up to you to protect it. The steps we've outlined today aren't just for you, they're for the people you care about. I want you to take a moment right now and think of 3 people you love. Your partner, your parent, your sibling, your best friend. Now share this video with them. One day, they might thank you for it with their life. This is why we do what we do, to get this knowledge out of the medical journals and into your hands, so you can make informed decisions for your health. If you found this video valuable, please consider subscribing to the channel and hitting that notification bell. We have so much more to share with you, and you don't want to miss it. Thank you for watching, and thank you for taking your health seriously. Stay safe, be well, and remember to advocate for yourself and the people you love. Every single minute counts.